my diagnosis timeline, so for me, it began when I was about 16. Before this time, I started experiencing some symptoms where my hip would give way when I was walking. Never thought anything of it. It never was accompanied by any pain, and it would just sort itself out. So in the early November of 2016, I was playing basketball, and I sort of had that same sensation, but the next day I woke up and I was in quite a lot of pain. So at the weekend, I went to the walking centre, and I was told it's just a groin strain and to sort of get some physiotherapy and it'll be fine. So I had my physiotherapy over the Christmas, and then in the sort of February to March time, I visited the GP because it wasn't getting much better. So I had that appointment, was referred to a specialist, waited about 9 weeks for that. In between, I went back to the GP with pain again, got given painkillers, and I saw the specialist in the late April time, I believe, and then I saw another specialist. I was referred on again, and by this time I finally had an x-ray. So my x-ray showed a stress fracture, like lesions from what the doctor said at the time. I wasn't really sure what to say, so I got out and I went on Dr. Google and I searched lytic lesions, which is a little bit of a mistake. So that was my first indication that I might have cancer, and then I did get a referral letter to see an orthopaedic oncologist, so that was another clue again. I had my biopsy, as you can see, I'm high as a kite on that photo, which is quite funny. And then I was diagnosed with Ewing's at that point. So my initial diagnosis, it was found that I had metastatic Ewing's because it was on my lungs as well. That was sort of within the first week. I had extra scans and things. And then I had the EWSR1 to ERG fusion, I believe. Probably means more to many people here than it does to me. But my primary site was my right pubic ramus, and then obviously my lung mets as well. The scan pictures there show the cancer as well in the beginning. So I was assigned the EU protocol and entered into the Ewing 2012 trial, and I was allocated Arm A, which involved having 6 rounds of VIDE chemotherapy, being vincristine, ifosfamide, doxorubicin, and etoposide, and then 8 rounds of VIDE, so vincristine, actinomycin, and ifosfamide. It was also a potential that I could have surgery on the area as well, and then I would receive lung radiotherapy at the end of my treatment. So this is some pictures from my sort of initial treatment. So this sort of was just the first beginning bit of my chemotherapy. I did react quite badly to the chemotherapy. I had all the general side effects that you get, the nausea, the constipation, the neutropenia. I also pretty quickly started experiencing hot flushes, and then I had some blood tests done that showed that I was experiencing menopause as well. I had a lot of fatigue, hair loss. I had a reaction to metoclopramide as well, which was sort of like a dystonic reaction where I had some sort of muscle cramping, neck stiffness, my tongue sort of went to the back of my throat, which was not a nice experience. And then I also had C. diff, and I had an NG tube placed shortly after that because I lost quite a lot of weight with that. So yeah, these are just some pictures. The top left is in the middle of my reaction. The bottom one shows my neutropenia quite nicely. But I did have a great support system, as you can see, from friends and family as well. So these are my scans from the end of the May to the beginning of the July. As you can see, the top scans of my lungs, they were on sort of an imaging level. They were now considered clear. Obviously, on a cellular level, that might have not been the case, so I was still to have the lung radiotherapy at the end. The pelvis as well, you can see I had a really, really positive response to treatment, which I was really grateful for. So that was fantastic. It was then rules that I might have proton therapy abroad. So this would be to my pelvic area. Now, my reason for proton was in that my bladder was quite near the tumour site, and with conventional radiotherapy, it would have sort of interfered with my bladder. So we applied to sort of the NHS board and things to get the funding for that, and I was approved. So that was set to happen in the September of that year. At this point, we also made the decision about the surgery. So it was sort of a bit up in the air, but from what I was told by my team, it would only make around a 1% difference in my prognosis from sort of all the papers that looked across. I did a bit of research and things. So for me, that just wasn't significant enough to go through such a sort of big surgery. So I opted not to have the surgery in the end. So I went for proton therapy in Jacksonville in Florida. I had quite high strength of proton therapy. This is about 35 sessions over like the course of a couple of months. I was also receiving my chemotherapy alongside this time as well. I did experience some skin irritation, but thankfully it wasn't too bad. I was using all the creams and things that they gave me, which did help quite a lot. So I was quite lucky in that sense. So yeah, that's my proton therapy really. I got to do some nice things, as you can see as well. I got to visit Magic Kingdom, and then that little pig on the right there was a little micro pig that was just hanging out outside the Proton Centre, which was quite cool. Yeah, so like obviously they have quite a lot of like therapy animals over there. The dog visited the hospital, but then the micro pig was a little bit cooler, so I just thought I would put that on there. I also brought one of these pieces of equipment home. So these sort of help the proton beam to sort of shape to your tumour. They're all specific to each patient. So the bottom one I actually brought home, which you can imagine was quite entertaining. Airport security when it lit up like a Christmas tree on the scan. So that was quite funny as well. But I did manage to get that home, and they did allow me through with it. In terms of the sort of last part of my chemotherapy, this was when I was sort of having the VI treatment and then the lung radiotherapy as well. So this scan to the bottom right here is actually my first sort of clear scan. So as you can see, there are some sort of changes to my hip, but at this point it was sort of considered disease-free, so that was in the January. I was also having a bit of pain at this time, so I had some physio and some hydrotherapy. But apart from that, I actually was doing pretty well at this point. It was more, I think, the first 6 chemotherapies that did affect me worse than these ones. At the end of my treatment, it was found that I had developed a bit of sort of a heart problem after having the chemotherapy, thought to be caused by sort of the doxorubicin, which I'll talk a little bit more about in the next slide. I also have some nerve damage and continue to have old bowel habits. I think with it just being the pelvic area, it was just a little bit of trouble that I had there as well. So in terms of the heart condition, I developed an impaired left ventricular ejection fraction. Now, they changed the threshold not long ago, which is why I've just popped that up there. But it was between 45 to 50%, and now it's at 51% after taking an allopril for quite a few years, which has helped. I just thought I'd mention as well that there's now a drug that actually sort of combats the effects of doxorubicin and other anthracyclines to be given to sort of younger patients now. I think it's called dexrazoxane, but yeah. So that's pretty impressive that sort of research has led to that, which is really exciting. I'll talk a little bit more about that later, but I actually received that drug a few years later. So in terms of after my treatment, I was continuing to deal with some side effects and things, and then I had my sort of first scare in terms of having a muscle hernia pop out. This picture was taken in the middle of Wetherspoon's dance floor. I was on a night out, vegan away, and this decided to pop on my leg, which did surprise me quite a lot. So I went home from that night out, and I saw my team the next day, had an x-ray, and there was like nothing to indicate that it was anything worrying. So I ended up just sort of getting an ultrasound and things, and it just seemed to be this muscle hernia that I'd developed. It was on my right leg, so you could maybe say that the mobility of my leg impacted it, because I spent a lot of time in bed. I was in a wheelchair at one point. I was on crutches a lot, so maybe sort of decreased my mobility, and then starting to walk a lot again might have had some sort of impact, but I just thought I would pop that up there as well. So, bit of another story. 2 years ago, around this time, I returned home from university after having COVID. So at this point, a bit of a backstory, I'd had some investigations for IBS. Now, this ultrasound picked up multiple masses in my liver. So I got the early call, got called into the room, and I got told that my cancer might have returned. However, it was very unusual for Ewing's to come back in the liver. So I was continuing to have this investigated, and I was referred to a specialist for a liver biopsy. Now, over this time, I had a few other worrying symptoms. I was in contact with my team constantly throughout. I had sort of worsening acne, which I never actually mentioned to my team because I just did not think anything of it at all. I also had a bit of weight loss. I was just a bit stressed with university though as well. It was sort of the time when local lockdown was happening as well. So that was quite stressful. But when I went for my pre-op assessment for this liver biopsy, I had my bloods taken. Now this is sort of what indicated that I had leukemia. So I had the worsening acne, which as you can see, progressed to be quite bad. I also have a potential swollen lymph node. I did visit the walk-in centre about this, and I was told that it was a dental abscess as well. I had rashes, and I had quite a high heart rate. Now, my mum had actually bought a heart rate checker thing and I was taking my heart rate, and it was just high at rest. It was about 130, 140, which I knew wasn't normal. Again, rang 111, got told someone would call me back. Got called back, it got cut off, but a few days later I had my appointment, so I just thought, right, it's okay. However, it was very much not okay, and I had leukemia. So I ended up being admitted to hospital on the 16th of December, so I spent sort of Christmas and New Year in the hospital. This is a very ugly picture of me with a lot of acne and a lot of bleeding and a lovely blood clot right in my right nostril there, but I just thought it showcased really well sort of how poorly I got. And obviously, if you look at the slide before, this was sort of being the September, so it was quite a significant decline in that sense. With my AML, it is a little bit confusing because I was told when I had my etoposide chemotherapy, when I signed all the consent forms, that I was at an increased risk of leukemia because of the treatment. So obviously it's just a couple of % chance. You don't really think anything of it at the time, but then a few years later I was diagnosed with that. I think it's really important because I was never on the lookout for symptoms of another cancer. I was always thinking, oh, bone pain, things like that. I did sort of monitor my weight and things just to sort of look for the symptoms, but I never sort of connected the dots with that. The bleeding obviously meant that my platelets were very low. So yeah, I ended up, when I got my genetic testing though, I had the T821 translocation, which is not something that's typical of T-AML, which is therapy-related AML. So usually therapy-related AML is very, very complex. It has a lot of genetic mutations and it's got a very poor prognosis. So this did confuse my team quite a lot because obviously I'd had the chemotherapy in the past, and the sort of time frame of my diagnosis of my AML pointed towards it being related to the therapy, but then on the other hand the genetics didn't, so it was a bit of a confusing one. However, I did have some further testing to test for the TP53 gene, which tests for Lee-Fraumeni syndrome. I'm probably saying that wrong, but that was negative as well. So with my team, they decided to go with a cycle of DA Mylotarg, which is daunorubicin, cytarabine and Mylotarg, and 2 cycles of hydrocytarabine, which I believe is more of like an American approach, because they wanted to avoid giving me anthracyclines again too many times, because I already had that pre-existing heart problem. So I did receive the dexrazoxane, like I mentioned before, which did actually, I mean, my heart didn't get any worse, so you could say that that did have some impact on protecting my heart, which was great, and it also helped me to feel a bit less nervous about having anthracyclines again. We opted for no bone marrow transplant as well because it was my sort of T821 is sort of like the middle one. So there's one that's sort of a bit worse that they always transplant. There's one that's a bit better that they don't usually transplant. And then I'm in the middle where it's sort of a bit of a question mark again. So they ended up not transplanting me. I also had my liver masses ruled out as myeloid sarcoma, which was potentially a possibility after they discovered my AML. But it did actually confirm adenomas, which is likely related to the HRT that I take because of my menopause. That is sort of another indirect side effect, if you like, of my Ewing's treatment. However, I responded really well again, thankfully. I achieved deep remission in January 2021 after 1 cycle. So yeah, that was a bit of an overview. Thanks for listening, and if anyone has any questions.